Do you like having lots of benefit options? Are you needing insurance coverage for things like vision, dental, or hearing exams? Then a Medicare Advantage plan might be right for you. Hi, I'm Cristina, a registered nurse with a background in care management, and I'm here to help you with your Medicare questions. Let's delve into the nuances of what makes a Medicare Advantage plan unique. Medicare Advantage plans, also known as Medicare Part C, are an optional and consolidated way to receive your Medicare Part A and Part B services. Medicare Advantage plans, commonly called MA plans, are regulated by Medicare but are administered by private insurance carriers. Medicare has four main parts to it. Part A, hospital insurance. Part B, medical insurance. Part C, optional Medicare Advantage. And Part D, optional prescription insurance. Now, Part C is the only Medicare part that combines the services and costs for Parts A, B, and D into one plan with consolidated costs. Many MA plans also offer additional benefits like hearing, vision, and routine dental exams that Medicare Part A and B don't cover. The plans can be purchased directly from the private insurance carriers. If you elect an MA plan, you retain the same benefits and protections you would have under original Medicare. The Centers for Medicare and Medicaid Services, commonly called CMS, is responsible for evaluating and rating the quality of MA plans. CMS rates the plan's quality on a scale of 1 to 5, with 1 being the worst and 5 being the best. So when selecting a plan, you can compare its CMS star ratings online to find a high-quality plan. In order to be eligible to enroll in a Medicare Advantage plan, you must first be a Medicare beneficiary, meaning that you must have enrolled in Medicare Part A and B, also known as Original Medicare. Then you'll be able to elect a Medicare Advantage plan instead of Original Medicare. Plans are offered per zip code and county, so when shopping for a plan, it's best to start by searching for ones available in your area. There are several different insurance models that comprise MA plans. The main types of insurance models include HMO, PPO, SNP, and MSA. Let's briefly review these. HMOs are health maintenance organizations, which are networks that must be used by the member for medical expenses to be covered under the plan. Within an HMO, the member selects a primary care physician from the network who would coordinate care and referrals to specialists. Now, within HMOs, there are some additional options such as HMO point of service plans that allow you to get some out-of-network services, but for a higher copayment or coinsurance. These plans will have specific rules like getting prior approval for a certain service. PPOs are preferred provider organizations, which offer more flexibility. Members can seek care from any healthcare provider within the PPO without the need for referrals. PPO members may seek out-of-network care, but the costs would be higher. In general, PPOs tend to have higher costs than HMOs. SMPs are special needs plans that are only for eligible individuals who have certain health or financial needs requiring specialized care coordination. All SMPs include prescription medication coverage. MSAs are medical savings accounts that function similarly to HSAs. This is a consumer-directed plan in which you would have a high-deductible health plan and a medical savings account. Money is deposited in the account according to the amounts established by the plan, and that can be used by the member to pay for health-related costs before meeting the plan's deductible. There are no networks of doctors or facilities with this type of model. If you'd like to review all these types of plans in more detail, you can visit Medicare.gov, where you'll find more information. I've included the link in the description below this video. When you're reviewing MA plan benefits, you can count on all MA plans to include services covered by Part A and Part B. things such as hospital admissions, doctor visits, medical equipment, and lab tests. In addition to these benefits, almost all MA beneficiaries have access to plans that provide vision exams, glasses, hearing exams, a fitness benefit, telehealth services, and dental care. Some plans offer more unique benefits, like meal delivery after a hospital stay, premium rebates, transportation for medical services, and a 24/7 telephonic nurse line. Typically, each insurance carrier provides a plan comparison tool on their website, where you can compare the benefits and costs of the plans available in your zip code. Most MA plans also include Part D, prescription drug coverage. Many Medicare beneficiaries elect an MA plan for the convenience of the bundled service with prescription drug coverage. If you need help reviewing plans from multiple insurance carriers, you can call our trusted partners at Apollo Insurance Group to speak with a representative and ask questions. You'll find their website in the comment section below. MA plan costs are going to vary based on what type of plan you elect and how often you require medical care. Some cost terms to keep in mind include premiums, deductibles, co-payments or co-insurance, and max out-of-pocket costs. A premium is the monthly amount that you would pay in exchange for having health insurance coverage. You'll need to pay this timely to ensure that your coverage stays active. You'll pay the same each month regardless of how much medical care you use. That being said, one selling point for many MA plans is that they do not charge premiums, so you would only need to pay your Part B premium, but not a Part C premium. In 2023, 73% of Medicare Advantage beneficiaries were enrolled in a plan with no supplemental premium. But for plans that do charge a premium, the average is $57 per month. Cost-sharing terms include co-payments or co-insurance. Co-payments are a fixed rate that you would pay for a service. For example, a $20 co-payment for a doctor visit. Co-insurance is a percentage of the cost. For example, 5% of a lab test. Each plan should list its cost-sharing prices so that you can compare plans prior to selecting one. The out-of-pocket max cost is the most you would have to pay out-of-pocket during the year for medical bills. This amount resets every January. Medicare mandates that the max out-of-pocket cost not exceed $8,300 annually, although most plans have lower amounts. The average out-of-pocket max in 2023 is $4,835 for in-network services. If you're ready to enroll in a plan, you may do so directly through the insurance carrier via telephone or online. There are certain times of the year when you can enroll, such as during your initial enrollment period when you turn 65, or during the annual enrollment period, which is typically October 15th to December 7th every year. Another time is the Medicare Advantage open enrollment period, from January 1st to March 31st. But this is only for those who already have MA plan coverage. Thank you for joining me in reviewing some of the unique benefits of MA plans. Be sure to check out our Medicare articles on healthnews.com and ask questions in the comment section below. Subscribe to our Health News YouTube channel so you don't miss any videos about Medicare. And I'll see you next time.